Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is 9 o'clock on Friday, so you know what that means. This is Friday Friends with RI Elder Info. I'm Deb Burton, the founder and creator of the nonprofit. And every Friday, I come on here to bring you information that you need to know about. Today, we are having a very, very important conversation, so it's super important that you hit the like button and the share button. We are a nonprofit, so we're really grateful to our sponsors, Oak Street Health, United Healthcare, Tamarisk Assisted Living. They are all wonderful organizations, and I strongly encourage you to check them out. Also, going to be happening on December 2nd, we are holding a hybrid training event for professionals on the 3 R's of hoarding, recognition, resources, and realistic action plans. And we're super grateful to Neighborhood Health for that, Cove Homes, East Greenwich Housing, Anchor Bay Assisted Living, Tufts Health Plan, White Cross Pharmacy. I really encourage you to check that out. But I don't want to take a lot of time because what we're talking about is extremely important. So again, hit the like button, hit the share button. You may be saving a life today. I'd like to bring up Director Yarn from the Rhode Island Office of Veteran Services and Jeff Hill from the Rhode Island Department of Health Violence and Injury Prevention Program out of the Division of Community Health and Equity. Hi, gentlemen.
Good morning.
Good morning.
Yeah, we synchronized our search today. Good morning. Good job with the blue.
Awesome. So gentlemen, as you both know, RI Elder Info, we really support our veterans. And, you know, the title for today is One is Too Many. And we know there's some research out there that there are 22 veterans a day who take their life. And even one is too many. So can you gentlemen share what resources are available here in Rhode Island where veterans can reach out if they are feeling like they may take their life? Either of you.
Sure. I think for many there are the obvious resources of the VA or the Vet Center. There's also the Veterans Crisis Line, which is the same phone number as the National Suicide Prevention Lifeline, 1-800-273-8255 or 1-800-273-TALK, which by July of next year will be 988. It's going to be one very simple 3-digit number that folks can call to be connected to the line. And so if you dial that phone number and you press 1, you'll be connected to the Veterans Crisis Line, which is a national network answered 24 hours a day, 7 days a week, and is available to provide services and crisis services to any veteran anytime they want. I've called it myself and been able to connect them for someone of concern. So if I was concerned about someone who I knew had served our country, I called them and been able to connect them, and they've reached out to that person to connect and see how they're doing. They'll do wellness checks if you're concerned about a veteran, or the other answer would be being able to call 911 and initiate emergency services and be seen for safety in the emergency room.
Jeff, thank you so much for that comment, because I like how you said, interceding on behalf of someone else. And I think that's one of the keys to reducing the stigma around this, to remove the stovepipes. That way, if you're, as an active bystander approach, if you see something, do something. Reach out to someone that's more capable of handling some cases of this nature as well. As when we started this work, Jeff and I started this work together, we thought about saying, hey, there is no one silver bullet that's going to resolve this issue. We need a series of bullets in that regard in order to identify. And I use that term bullet usually because I know suicide and along those lines too, which I'm very cautious about using those terms. But we got to do what we can to remove the stigma associated around it, and people accessing, taking that step to get a help. In addition to what Jeff mentioned, we also utilize this thing called RI Serves for our veteran space, puts all our community providers in a collaborative network to ensure that no veteran, and more importantly also as well, offer services for the family members, which is part of a bigger network called Unite Rhode Island. It puts all of our providers in a same network to where no wrong door approach, to where if I'm a Rhode Islander, I can get access to a benefit along those lines. And we're living in a world now, we should have that number committed to everybody's memory. 1-800-273-8255. 1-800-273-TALK. Those are the critical. This is what's going to help us move the needle along those lines. Working together with our local, state, and federal partners in order to resolve these issues that are facing our veteran population. You said earlier, one veteran death is one too many. And so if you take a look at that 20 to 22 number, just think about it. And so when you talk to Director Connell at the VA, they're going to tell you, say, hey, look, of that 2022 number, 14 of those veterans are not enrolled in the VA healthcare system. So part of my conversation is to change the narrative, is to engage with the family members of the veterans to get them to enroll in the VA healthcare system. An example, say if they didn't have a pleasant experience at the initial, then Director Connell's crystal clear, laser pointed in his message regarding, hey, give us a second chance. Let us make this right. Use my office, use Jeff, anybody else in order to make those steps to engage with our federal VA partners to try to make it right and give it a chance. And so one of my roles is to create a buffet menu list of items, because we know that getting help means differently to each other. And so it's so important to have that list and openly available, readily available, so a veteran and a military family can get access to and some help.
And I think, it's really important when you talk about the stigma around mental health. Every single person on this globe in the last 18 months, 2 years, have really been impacted by the COVID pandemic. We've seen a big increase in mental health concerns coming up. And when you're kind of wrapped up in your own mental health issues, you might not recognize necessarily that you need help. So what are some of the signs that family members or bystanders might see that it's like, oh, wait, my friend is doing that. Maybe I should call the crisis line. What are some of those things that folks should watch out for?
Well, I think it is being mindful of this time of year. Separation from loved ones, COVID-related, some deployed, what have you, just distancing from your family members. That in itself is an appetite to assume that there's disaster associated around it too, and be to listen, to understand, say, hey, this is holiday season. I may be separated from mom. This would be a time to say, hey, this may, some of those feelings may start to raise up. Loss of a family member around this time frame, which is extremely traumatic. We lost our son around this time as well, and I'll be mindful of that too. So continue to do. Jeff talked about the health and wellness check, to continue to check up on folks, and I think that's good citizens. This is being neighborly, just to say, hey, how are you doing today? What's going on? And Jeff talked about smile, and I know when we do our SAMHSA work with the Governance Challenge, which we're going to talk about in a little bit. When we first start out, we do a round robin just to do a health and wellness check for everybody. Smile, put on a little music, doing something to say, set the mood. Hey, what's going on in your world? We have to have increased interest in each other's livelihood, to check up on each other and to say, hey, how you doing? How can I help? Okay, let's go take a walk together. All those nuances around, serving each other. And I think it goes a long way. And I'll pause there, let Jeff provide some comments.
Sure. I think some things to think about in this time of year, also, the loss of a spouse or a partner, even in the last few years, brings about that sense of loss. So a sense of loss is one of those things that folks look out for, because, we all get lonely. Distance between family not being able to see family, especially during COVID, was incredibly difficult. People like that human touch, being able to give a hug to someone, seeing your grandchildren, things like that. It's difficult. But other things to look out for would be, someone's suddenly giving away their things that are meaningful to them. That seems out of the ordinary, or making plans that just seems out of the ordinary. Maybe they're happy, maybe they're not. It's always good to ask the question. I always say I'd rather have a friend be mad at me for asking them if they're having something than not have them sitting there next to me the next day.
Amen.
And so, take the time to do that. Increased substance use, especially, is another thing to look out for. Someone's sudden interest in firearms or something like that. If they're not,
use of alcohol and abundant overuse of alcohol. That's also a warning sign when you do, have holiday parties and things of that nature too as well. And that's something, another flag you potentially look out for also.
Right. Or someone continually talking about being a burden to others. That's another thing that we've heard and seen when we do fatality reviews is people feeling burdensomeness, or that they don't feel like they belong anymore. And so finding that way to reach out and make sure that people are part of a community, because there is a large community. I think one thing that I appreciate about the veterans in Rhode Island and folks is that veterans make up 6% of our population in our state, but the folks that use the Lifeline, that call and reach out for help, 40% of those callers are veterans. And I don't say that to say that veterans have more issues than others. I say that because veterans reach out for help more. And so I think that that's, an important thing to know, is that just by calling that line doesn't mean that it's a sign of weakness or that there's something wrong. It just means that you know how to reach out for help, and that you're doing it.
It's been very interesting. There had been some media reports about increases in suicide during the Afghanistan situation. And I was glad to hear that here in Rhode Island, we didn't see an increase in veteran suicides. And I think part of that is because we're a small state and, everybody knows somebody. There is no 6 degrees of separation. It's like 2 degrees.
Yeah.
So when that was happening among my veteran friends, what I was seeing, like, immediately were buddy checks going on and people reaching out and saying, hey, if you're not okay, call the Veterans Crisis Line, call the 1-800-273-8255, hit number 1. Like, people are going to answer. And then because, I'm one to always ask questions, I was asking somebody, I'm like, how quickly does someone answer the phone? Because if somebody's in crisis, you might not have time for them to be on hold. And I was happy to hear that the crisis line here in the Northeast is answered like the fastest. And like response is super fast. So if somebody's in crisis, when they call the 1-800-273-8255 and hit number 1, like, help is right there. And I think it's that sense of community that we have that has been a protective factor to not see those spikes as may have been seen in other parts of the country. And I think in that way it's a blessing, but one is too many.
Right. And I totally spot on with your comments. And I also add too, we also have another great, tremendous resource here in Rhode Island is BH Link. 401-414-LINK 5465. Another resource that we have here through our, again, in order to reduce the stigma, utilizing our other sister agency as well. And BHDDH, Buddha, has been a tremendous partner along with this process. And it connects, our Rhode Islanders, veterans, family members with resources, and, that are experiencing a behavioral health crisis. So again, kudos to BH Link, centrally located facility. The walk-ins at 975 Waterman Avenue in East Providence. So kudos to all the townies. But no, again, just go to reiterate the point that there are so many resources available, and take the time to do what's right for you alone. But you got to take that step. And our job, our civic duty, is to assist you with taking that step.
Go ahead, Jeff.
Yeah, I was last night, about, I think at what time it is, at 7 o'clock last night, there was actually the VA put on a program on suicide prevention resources for caregivers of veterans. And I think it's important to recognize the unique challenges that caregivers have, especially now during COVID in terms of being isolation. I want to recognize those caregivers that are caring for their veteran in the community, because that's a tough job. It's a tough job for anybody, taking care of folks. But I want to recognize, the unique things around being a caregiver, and also recognizing that they're under a lot of stress too. And so the VA is actually rolling out a new prevention program for the caregivers. And the Elizabeth Dole Foundation actually has some respite programs as well for caregivers on this, and there's funding available for that through the Elizabeth Dole Foundation, which I think is a really important aspect to think about when we're thinking about everyone, and not just the veteran, but also those who are caring for that veteran, because that's a very unique and special role that folks play.
Yeah, absolutely. And I have to say the caregiver support group, support office at the Providence VA is absolutely amazing. They're out sharing the word that there's help available. There's caregiver support groups. There's just reach out to them. And that's really important, because it can be very hard for the caregivers. And if someone has that sense that the caregiver is frustrated or overwhelmed, it could lead to that sense of, well, I'm a burden, which then kind of starts that downward cycle. So we want to make sure that resources support everybody who's touching that member who served or is serving, as the case may be. That's super important. What are some of the things that are available that can actively maybe prevent a fast decision that has a lifetime consequence? We've got the 1-800-273-8255, press 1. So are there other things that people can do? I mean, I know sometimes military members, veterans, might be nervous about having something in their file about, having thoughts or concerns about taking their life.
Well, I think that too, and that's a valid point, and in terms of pride associated. But I know veterans are more apt to talk to other veterans that are in this space. That's why I love using the vet center option, because it's held with confidentiality, and rightfully so. That way, there's no sense of any type of reprisal or pushback, blowback from the boss along those lines too, because your credentials are protected, along with your family. And again, too, and so as we look through these things, look and turn into page to next year, we continue to find ways that we can engage at the lowest level possible. Continue to participate in the town halls events, to partner with our federal partners, to get engaged with our local municipalities, because that's so critical at the grassroots level. I mentioned earlier, like East Providence, well, having an active presence in all 39 municipalities is so critical. That way, so if a veteran is in a municipality, they know what number to call. They know how to reach out to my office to engage with Director Yarn and his team and a cohort of cohorts along those lines. And I said not tongue in cheek, but a cohort of cohorts, because our RI Surge network is nested into a bigger network called Unite Rhode Island. And again, to connect all of our providers, that way there's no wrong door approach. Where I'm in East Providence, I'm in Providence, or I'm in North Kingstown, I can get access to benefits and assistance along those lines to reduce that stigma, but more importantly, to address any behavioral issues that you may have along those lines.
That's awesome. And I have to say, we spoke with Justin from the Vet Center last week. And if any of the viewers today missed that, I really encourage you to go back and look at last week's Friday Friends, because the Vet Center's data and records, if you are an individual who is concerned about what is put in your records, the Vet Center records are held separately from the actual VA records. So you're free to reach out for help there, and there's no connection to like your original file. Not really sure what that's called. So that is super, super important. I know Gene Smith over at the Providence VA also runs the suicide prevention office.
Right, and she also participates, an active participant in our Governor's Challenge team as well.
Oh, awesome. Awesome. And one of the things that she had mentioned was they actually have, and forgive me if I am not using the right term, but like a gun safety lock so that the gun can be rendered not usable.
They do. They provide gun locks for the community at no cost. I have them available from Rhode, from the VA, that we can provide for community partners as well. In fact, many times we work in conjunction with Jean. If I'm at a community event and she can't be there, I'll provide the VA materials on her behalf. So it's a very nice relationship that we've shared for quite a few years between the VA and the Department of Health.
But it talks about who we are as Rhode Islanders, and I say we are blessed because we're locked in step with our other agencies, like Rhode, like VHDDH, and we also lock in step with our federal partners as well. But again, providing that collective impact, and that's the only way. The next steps in order for us to reduce that stigma, to start to reduce those numbers, is to work in a collaborative way, using all of our resources. Bringing all resources to bear to push this back.
And among the collective resources, I know sometimes an individual may have taken their life in a way that may not initially appear to be suicide. The 100 miles an hour in the car into the tree with no brakes, like no brake marks, things like that. Are there resources for individuals who maybe have addictions issues that might be pushing them towards bad choices or overdosing and things like that? Are there resources that can help our veterans become well and whole again if they have substance use disorders?
Yeah. One of the first ways to start doing that would be to reach out through BH Link, and they can help connect you with medication-assisted therapy. And so you can access those things through the VA. You can access those things through the community. And so there are some folks who may not want to use the VA for whatever reason for those services. They are available in the community as well. Many of our community mental health centers and treatment centers have access to buprenorphine and other medications that can help someone, as well as counseling to break away from their addiction, whether it's to opioids or alcohol. Alcohol is the number one drug of choice in Rhode Island. Unfortunately, alcohol is just as deadly in many cases, even long-term health concerns related to alcohol use. And so there are many treatment programs that are available, especially in the community. Another thing that folks probably don't often think about as well is there are programs available from the Rhode Island Lottery for problem gambling. Wow. And so as we think about, you have tele-lottery tickets now. You can do that online. You can, purchase lottery tickets or go to the casinos, things like that. So the Rhode Island Problem Gambling Association also has programs that are available for folks, and that's funded through the Rhode Island Lottery to help folks with problem gambling. And so there are different resources for different things to help folks out.
That's really important. One of the things that passed during COVID that a lot of us were not real comfortable with was the fact that alcohol can be delivered to your home now. Mm-hmm. It's not a good choice for many people. So when someone calls the 1-800 273-8225 and press number 1, do they speak with a clinician, or do they speak with a fellow veteran, or is the person they speak with both?
They could be both.
Awesome.
There are 3 different call centers located around the country that are staffed up for that. Mm-hmm. And so they could be getting someone who is a veteran who has served and is also a clinician, but they're all trained.
Awesome. And Director, shout out to Megan Conley from your office for connecting Jeff, but she made me promise that I would make sure that you were able to get to your next meeting, even though this is an incredibly important topic. So if you need to drop, please, I don't want to hold you from something else. I know that this is a topic that is very near and dear to your heart.
Oh, absolutely. And when I've been tasked with being the state's number one advocate for our veterans and military families, we take all of these to heart, and these are our mission sets, and these define what I do. By partnering, because this is so important, partnering, leveraging the capabilities from private sector or nonprofits. Organization like STREET, we provide grant funding to support yoga as an alternate means as well. Again, ladies, we know that help looks differently for each father, and my job is to provide all those resources available to allow you to give the veteran and military families options. Yoga is another viable option that's out there too. And kudos to our team at SRI that offer these services for not only for our veterans, military families, those that are active duty, Guard and Reserve, also our first responders as well. Looking to bring them into the fold also. And again, this is a totally community effort. And our first responders, law enforcement, our fire departments are all part of this team that we can do a better job serving them as well to address their mental health and behavioral issues also.
Right. And I think it's important for the general public to understand that just because an individual served doesn't mean that everyone has a mental health issue because they've served. And to get rid of that stigma around that, I think there's a lot of misperceptions that can be out there as to who veterans are, what they look like, and what behavior to expect. And right. I encourage people to just see an individual.
Oh, absolutely. And it's about staying community engaged, and utilize platforms like this to continue to facilitate the discussion, knowing that we are in the holiday season, knowing it's a time of the year that those falling into that deep hole could rear its head up here and increase it. So now we acknowledge that, okay, so now let's start the health and wellness checks. Let's continue that engagement, even though COVID has separated us a little bit. But again, we're utilizing technology to support us, not hurt us, to have those engagements, continue to facilitate discussion, continue to do those health and wellness checks, continue to meet periodically as organizations together to find out ways, how can we support each other? What events do we have coming up? How can we plan those events? For example, May 20th, our Call for Action Day, we did our annual one last year, but we've already begun planning for the next event. This is why this is so important. Utilizing SAMHSA, the Governor's Challenge here in Rhode Island, we meet on a monthly basis, the third Thursday of every month at 3 p.m. via Zoom, and we share information. We look forward to our next meeting. We've already got our agenda built for December. We have 3 folks in our community, organizations that are coming to talk to brief us on what they're looking at, what their outlook looks like for 2022 as we exit 2021, looking forward to next year. Okay, how can we work together to plan to build different type of venues, programs that continue to bring and highlight the mental health and to put the components to work together.
That's super important. And I think that is one of the things that makes being here in Rhode Island a blessing, is that, we all can reach out and know somebody who is participating in this or is a resource. I think that's truly a blessing of living in Rhode Island for many reasons. But in order to save an individual's life, to help someone who may be struggling, who may feel like, they're in a dark hole they can't get out of, to be able to reach out and say, call 1-800-273-8255 and hit number 1, and somebody answers the phone and answers the phone quick. And if you need somebody to come to your house, they can come to your house. If you don't want them to come to your house, then they don't do that either. These things are important.
And if you don't want to talk to the Veterans Crisis Line and you press 2, it's still going to be answered in Rhode Island. The National Suicide Lifeline is answered in Rhode Island at BH Link, and Rhode Island has the highest answer rate in the country.
Yeah.
So, you're going to be talking to someone local.
Yeah, and we've had BH Link on Friday Friends in the past, and the virtual senior resource fair. But for those folks who maybe missed that, BH Link is right on Waterman Ave in East Providence. You park in the back of the building, so nobody's going to see your car. You just walk right in. There's a little buzzer system, but everybody gets buzzed in. It is not a locked facility, so you can go in and say, hey, I'm having these thoughts of hurting myself, or I'm having a problem with a substance use disorder. And there's somebody at the desk who's like, I understand. And you can go. It doesn't matter if you have insurance. It doesn't matter if you don't have insurance. It doesn't matter what your insurance is. They're there to help you and get you connected to the resources. So there's a lot of different options. And I think it's really important that people know that we care. If
And I
you're
think
watching this, like you know, at least, at bare minimum, there are 3 people in this world who want to know that you're here tomorrow. That's something that's really important. And if you need to call the 800-273-8255 and hit 1, great. If you want to reach out to Director Yarn's office, I know you can do that. That's and his contact information is running below. It's all those different pieces.
Absolutely. Well, that was well said, and I thank you all for participating. I do have to get to my next event,
Yeah.
but again, I can't ask for better partners. Deb, with your hard work, and Jeff, kudos to your team. Continually, we've been down this. We first started down this journey. Well, we know the It's Okay Not to Be Okay campaign. Then we did the Change Direction campaign, which is highly successful. We started the road shows with the resource centers and the resource fairs, and we continue to do that. And we're looking forward to 2022 to even expand our services across our state, and to partner, take a look at all critically too what other states are doing in this space, and bring some of that back to us too, to try to implement some of those effective practices as well.
That is awesome. Thank you so much for taking the time to join me today, Director. I really appreciate that.
Have a blessed weekend, everyone. Take care, and we talk soon.
You too.
Take care.
So, Jeff, if you can hang out for a minute, can you tell us more about what is being done in this space in the Injury Prevention Center?
For the Governor's Challenge, or for Rhode?
Explain. Tell everyone what the Governor's Challenge is.
Sure. Well, several years ago, the VA and SAMHSA, the Substance Abuse Mental Health Services Administration, put together a program for preventing suicide among service members, veterans, and families. And there were 2 different segments. One was a mayor's challenge and one was a governor's challenge. And initially, they had signed up as a mayor's challenge, and it just didn't make sense to be a mayor's challenge because our state's so small. That we said, let's look at this as a statewide initiative. And so Director Yarn and I and a member of the Hospital Association and someone from the VA, we went down to Washington, D.C. and went through a 3-day meeting with other states who had started up with the Governor's Challenge, and looked at, what could we do in Rhode Island. Governor Raimondo had gave us the green light and said, yep, we're signing up for this. You're my people, and said, get this started. And so we had our charge to look at this. And so it was a 2-year planning process of working with their technical assistance advisors on the areas that we wanted to look at in Rhode Island, and set up our plan for reaching out. And so we have 3 different areas right now that we're focused on. One is looking at working on a program that was actually started in New Hampshire, which is called Ask the Question, which is when someone presents at the emergency room or in primary care, being able to ask, are you are you a veteran, or are you serving or have served? Because there may be special unique concerns related to veterans that are not necessarily always relatable to those in the general population, or a family member of someone who is serving, because we certainly know that while someone's away, that there may be other stressors or things like that the family might be going through, that the physician or the health provider will want to take into consideration in doing that, and they won't know unless they ask, and validate those those kinds of things in doing that. And so people can say yes or no. There's no issue around saying yes or no. And so that's one of the parts of what we're looking at, is being able to ask that, and then being able to, because then there are other resources that can be made available for folks.
So when you say it's the Governor's Challenge, is the challenge to reduce the incidence of suicide among our military members and veterans to 0? Is that the challenge, or is the challenge to start asking the questions? Or both?
It can be whatever we decide it is.
Okay.
I think 0 is an amazing goal. I think 0 is an achievable goal. One thing that we know about suicide is it's always preventable.
Yeah.
And so it's just a question of getting there. And really, for me, it's about preventing crisis. Because once someone's at the point of crisis, it's a much more difficult road. versus getting ahead of things and making sure people have what they need before they're in a crisis. If someone has, I think of it as the EAP, the Employee Assistance Program of life, where, if someone's having financial difficulty, they're getting some advice and some help with that. If someone's having relationship issues, and we see this often, especially with men, is our relationship issues and financial issues, where you're used to feeling like you're the caregiver and you're the provider, and suddenly you're not. It can be a very difficult situation to be with. And often it's maybe 50% of folks might have a mental health condition where they might feel some depression and anxiety. There may be another more serious mental health condition, but that's not always the case. And so many things that could lead someone to thinking about ending their life are more environmental. It's that marriage breakup, it's the loss of custody of children, or the death of a spouse, or those other things where there's a real sense of loss.
Yeah.
And so those are things that we can help with, that don't take a pill, that,
Right.
that folks really can help with. And I always think, folks need a sense of hope.
Yep.
Right. I look up at the state flag every day, and there's a big sign on the anchor, and it says hope. And I don't know, there's a quote from Hebrews that talks about, the anchor being a sign of hope, steadfast. That's really what, we should be thinking about as Rhode Islanders, is saying, let's give each other a sense of hope, and use that anchor to ground us and say, hey, we're here for each other, and let me help you get through this. Folks have their battle buddies, which is another way that you can, get through those tough times. And so really, being able to have that compassion and being able to listen, because often folks they're saying something to someone, and being able to put the pieces together and saying, hey, you know what, they're really struggling. Let's see if we can get you some help. And if I can't help you, let me help you get to where you need to be.
And I think it's important too that, if you have veteran or military members who are your friends, and you're a civilian. I'm a civilian. I tell everybody all the time, I am not a veteran. I have not served, but it's my belief that when a man or woman signs on the dotted line to possibly die to give me freedom and ease of life, then it's my responsibility to give back to them what I can. And what I can is information and resources, and a listening ear and a shoulder. And I think it's really important that as civilians, that we know our friends, that they may have experienced things that we as civilians can't comprehend. For example, I will never get used to hearing my friends say, well, that one time I was blown up. Well, the second time I was blown up. I personally can't wrap my head around that. But what I can do is listen and say, wow, okay, that must have really been hard.
Sure.
There's things that as civilians we'll never understand, and battle buddies are really important. Not everybody stayed connected to their battle buddies, to the people that they served with. So as civilians, I think it's also important for us that when we're listening, that we listen twice as much as we speak. And when we see a friend struggling, that we do tell them, hey, there's this 800 number, and they answer really fast. And I don't have the answers, but they might, just call the 1-800-273-8255 and hit the number 1. You don't even have to listen to press 1 for this and 2 for that and rub your head and pat your belly. Maybe you get somebody, just 800-273-8255, hit the 1. You don't even have to listen to the prompts, just hit 1.
Or say, hey, if I call this number, will you talk to them?
Exactly. Oh, I
because
like
often
that.
getting over the anxiety or that hump of actually picking up the phone and calling the number often is really difficult, because I find that, we all know we have health benefits. We all, right?
Yeah.
We might know we have mental health benefits, but how often do we really look at saying, what do we have and how can we use it and how will it help me?
Right.
That's a pretty difficult thing for a lot of folks to do. We know to call 911. We know to call the doctor if we got a cold or we're not feeling well or we have to have an annual physical. But how often do we think about, should I really reach out to someone to talk to? And what would that experience be like?
Exactly.
once you get, like anything, I think it's like riding a bike. Once you get over that first day of being nervous about something and actually going through it, it's really not that scary. It's really not.
It's it's the first step on a 1,000-mile journey. It's you just move forward. But I really like that idea that if you are that friend, to say, hey, like, yeah, I got my phone here. Call and we can put it on speaker and I'll hold your hand through it.
Sure.
I'll be by your side. You're not alone. I think, like you and the director have said, it can be really hard at the holidays for folks. There were a lot of celebrations last week for Veterans Day.
And then they stopped.
And they stopped. And Chaplain East made a really good point. She was speaking at an event for women veterans. And she said, not all veterans are comfortable hearing thank you for your service because they're not comfortable with their experience. And that perhaps changing our language and saying, thank you for your sacrifice. Because no matter what, when you're serving, even when you're going to basic training, you're sacrificing time away from your friends and family. So across the entire spectrum of service, individuals who signed on to serve sacrificed, period.
And their families did too.
Absolutely. Absolutely. Yeah.
So that's why this challenge includes families, because we know that families make unique sacrifices as well.
Yeah.
Not just the warrior, but the families as well.
Yeah. Yeah. So this has been great, Jeff. I'm really glad that you and the director were able to join today. I really hope that people are hearing what's being said and understand that please don't take your life. One person is too many. And there's resources available and they're kind and they're compassionate and they get it. And, if you're concerned about what's in your records, call the vet center. Go to BH Link. You can walk into BH Link 24/7, 365. So Thanksgiving comes and you're having a rough day, whether that's, mental health concerns or substance use disorders, walk into BH Link right on Waterman Ave. Your car is parked behind the building. Nobody will see it.
Right.
All those different pieces, help is available. So.
Okay.
Any final thoughts, Jeff?
No, I think, just knowing that there's hope.
That's it. The state is anchored in hope, right?
That's right. I always think of life in frames. What's my next frame going to look like? What's that picture?
I like that. Well, Jeff, thank you so much for coming on today. I really appreciate it.
You're welcome.
You have a great day.
You too.
So everybody, super important conversation. I really hope that you've hit the like button and that you've shared this. Share it with your friends. Share it publicly on your news feed. Share it in the groups. We have a lot of veterans here in Rhode Island, and it's really important that they know that they're not alone and that help is available. We don't want to have one single person lose their life. We don't want our veterans and military members to feel like they're alone. So it's really important that we share and we reach out and we check on people and let them know that we care. That's really, really important because one is too many. So I look forward to seeing you all next week. And in the meantime, be kind and be well. Thank you.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.